Hello, my name is Dr. Srikanth V. I am a practicing plastic and cosmetic surgeon at Manipal Hospital, Bangalore and at Clinique Belle, Bangalore. In a cleft lip and a cleft palate repair, a well done cleft lip, cleft palate repair, nobody can make out that the surgery has been done. So, unless the surgery was not done to your expectations, the smile will almost always be normal. However, sometimes there may be some amount of technical differences in the way the surgery is done. If there is no approximation, that is no good union of the two muscle ends, they may not give rise to a good smile. Sometimes there may be peaking of the lip, peaking of the cupid's bow. Sometimes there may be a notching in the lip, which may lead to a little different kind of smile. All these are minor problems and they can be very well corrected by almost any plastic surgeon. There are very many procedures that are done, like a simple scar revision. Sometimes a bit of a dermofat graft may be put in. Sometimes a small fat injection may be done, or a vermillion advancement may be done. All these are minor lip corrections which can be done, which can help to restore a smile. And in men, if they are desirous of getting a moustache, they can think of getting a hair transplant done onto the scar, which will hide the scar very well.